So hello guys, in today's lecture we are going to talk about the types of dialysis. So before talking about types of dialysis, we must know that what is a dialysis. So the definition of dialysis is a process whereby the solute composition of solution A is altered by exposing solution A to a second solution, that is solution B, through a semipermeable membrane. Here the water molecules and low molecular weight solutes in the two solution can pass through the membrane pores, but the larger solutes such as proteins cannot pass through the semipermeable barrier. So there are two types of dialysis. First is hemodialysis and second is peritoneal dialysis. One by one we are going to talk about both of them. Firstly we are going to discuss what is hemodialysis. So hemodialysis. Here a HD machine removes the blood from the body, filter it through a dialyzer, which is also known as artificial kidney, and return the cleaned blood to the patient's body. This generally takes 3 to 5 hours long process, generally take place in dialysis center or a hospital. Now basically what we are going to discuss is what we require before the HD treatment and what we require during the HD treatment, and what are the consequences or what are the complications which we face after the dialysis. So firstly, before HD, what we do, before we start hemodialysis in a patient, the patient undergoes a small surgery to make it easier to access the bloodstream of that patient. So during हीमोडायलिसिस, बिफोर हीमोडायलिसिस जो पेशेंट होता है उसकी एक माइन्यूट सी सर्जरी की जाती है, मेनली वेन और आर्टरी को इसके अंदर इस सर्जरी के दौरान जोड़ दिया जाता है और एक एनास्टोमोसिस बनाया जाता है, एक फिस्टुला फॉर्मेशन होती है. मेनली ये रेडियोसिफेलिक और ब्रेकियोसिफेलिक वेन होती है. रेडियोसिफेलिक फिस्टुला और ब्रेकियोसिफेलिक फिस्टुला, ये दो टाइप्स के फिस्टुलास जो होते हैं मेनली कॉमन होते हैं. तो इस सर्जरी को हम एवी फिस्टुला सर्जरी बोलते हैं. और इसमें व्हाट हैपन इन दिस इज दैट अ सर्जन कनेक्ट्स द आर्टरी विद द वेन ऑफ द पेशेंट. देन द सेकंड थिंग विच वी कैन डू इन सच पेशेंट इज़ दैट अगर फिस्टुला उनके अंदर नहीं बन रहा है, इन केस समटाइम्स की जो वेन्स होती हैं वो बहुत ज़्यादा माइन्यूट पतली होती है, तो जो सर्जरी करना होता है वो मतलब ईजी नहीं रहता. इन केस दैट केस वी join them with a plastic tubing, और इस चीज़ को हम बोल देते हैं AV graft. If the artery and the vein are too short to connected by the surgeon, usually insert a soft hollow tube to connect the artery and the vein. If the dialysis is needed quickly, a temporary catheter is inserted in the neck. अगर वो neck के अंदर insert हो रहा है तो उसको internal jugular बोलेंगे, अगर वो leg के अंदर हो रहा है तो उसको subclavian, और अगर वो chest के अंदर direct insert करें तो वो subclavian कैथेटर हम बोलेंगे उसको. उसके बाद जो बात है वो है ड्यूरिंग हीमोडायलिसिस व्हाट वी आर गोइंग टू फोकस ऑन इज दैट द डायलिसिस मशीन्स रिमूव्स द ब्लड फ्रॉम द आर्म, सर्कुलेट द ब्लड थ्रू द डायलाइजर फिल्टर, मूव द वेस्ट इनटू डायलिसिस सॉल्यूशन. तो इसमें क्या होता है कि जो मशीन होती है वो बॉडी में से ड्रॉ कर लेगी ब्लड सारा थ्रू एक ट्यूबिंग होती है, एक्स्ट्रा कॉर्पुलर ट्यूबिंग के थ्रू ये ड्रॉ करेगी. Then it will pass it through the dialyzer filter, move waste into the dialysis solution. जो dialyzer filter होता है उसके जो external membrane hollow fibers के दूसरी तरफ जो membrane होता है उसके दूसरी तरफ जो dialysate fluid होता है उसके अंदर सारा waste transfer हो जाता है. वो transfer होता है mainly by the principle of diffusion ultrafiltration. Here the filtered blood is returned to the patient through a different needle. The patient's blood pressure is regularly monitored throughout the session and the blood flow is adjusted accordingly. Here we have depicted the photograph about how the hemodialysis treatment occurs in a patient, and here we can see the needle is coming and drawing the blood out of the body, then it is pumped through the blood and passing through the dialyzer filter. Later it is filtered and again inserted into the patient. After the dialysis, some patient experience low blood pressure during or immediately after the hemodialysis. You may feel nauseous, dizzy or faint. Other side effects of dialysis include chest pain, back pain, headache, itchy skin, muscle cramps, restless leg syndrome. These are some common symptoms that the patient might faces when he is undergoing a dialysis treatment. The next type of dialysis is known as peritoneal dialysis. It is also another important modality which is done in the patients who have renal failure. So peritoneal dialysis is a way to remove waste products from the body when the kidney can no longer do its job adequately. During peritoneal dialysis, blood vessels in the stomach's abdominal lining, the peritoneum, act as a filter. So here we don't draw out the blood out of the body from the patient. We just insert the peritoneal fluid into the peritoneum. Here the capillaries will capillary will act like a blood circulation system. Peritoneum will act as a semipermeable membrane, and throughout the dialysis procedure will occur. So here the peritoneum just act like the kidney. It filter much like kidney and help the dialysis fluid that goes in and out of the cycle through the catheter into the abdomen. With the peritoneal dialysis, a tiny blood vessel inside the abdominal lining peritoneum filter blood through the body, and this is a aid solution which is called as a dialysate. This solution is a type of cleansing liquid that contains water, salt, and other additives. Peritoneal dialysis take place at home, so unlike hemodialysis, we can safely do it in our home. However, in hemodialysis, we have to particularly go for a dialysis center or in a hospital for doing the treatment. There are two types of treatment mainly which we do in peritoneal dialysis. Mainly first is automated peritoneal dialysis. Here a machine called cycler is used. Another example is a continuous ambulatory peritoneal dialysis, that is also known as CAPD, which is just done manually. Before peritoneal dialysis, about 3 to 4 weeks, a minor surgical procedure is also done here. A surgeon insert a soft thin tube catheter through the belly into the peritoneum. This catheter stays at the place permanently. So here we just simply insert a soft tube catheter inside the belly of the patient into the peritoneum for just moving the dialysate fluid in and out throughout the session. During the peritoneal dialysis, one must connect the catheters to one branch of Y-shaped tube. This tube connects the bag that has dialysis solution. The solution flows through the tube and catheter into the peritoneal cavity. Now the next step is we have to disconnect the tube and the catheter after about 10 minutes when the bag is empty. Now just simply cap off the catheter. Go about as usual activity while the dialysis solution inside the peritoneal cavity is absorbed waste and extra fluids from the body. This procedure can take around 60 to 90 minutes. Remove the cap from the catheter and use the other branch of Y-shaped tube to drain out the fluid into a clean empty bag. So simply after a duration of 60 to 90 minutes, we just remove out the dialysate fluid out of the body through the second tube of the Y-shaped connector which we were using, and that fluid is moved into another drain bag, and now we will measure the amount of the solute which we have removed out of the body through that bag, and we'll also face that how much the fluid is removed. Generally the fluid sometimes get reabsorbed into the peritoneum, so in that case it is important to know that the proper fluid is being drained out of the body, or otherwise the patient might go into volume overload, which will severely lead it to hypertension. Now repeat these steps up to 4 times a day. Now some people prefer peritoneal dialysis at night with automated peritoneal dialysis machines called cycler pumps and fluid in and out of the body when the patient is sleeping. Mainly after peritoneal dialysis, what are the complications that patient might face? So there are some people develop skin infection around the catheter. You are also at a risk of peritonitis, that is the inflammation of peritoneum. Here an infection that occurs when bacteria get inside the abdomen through the catheter. You may experience fever, abdomen pain, nausea or vomiting. Using the abdominal catheter and the pumping your belly full of fluid can weaken abdominal muscles. So doing this practice again can severely affect the abdominal muscles and they can weaken over the time. You may develop a hernia. So it is commonly seen in the patients who are going through the peritoneal dialysis therapy. They might develop hernias. So the hernia is a protruding structure which might occur. This condition occurs when the organs like small intestine pokes through the abdominal muscles. You may feel a bulge near the belly button or in the groin area between the abdomen or the upper thigh. Your doctor can repair a hernia with the surgery. During peritoneal dialysis, your body absorbs dextrose, sugar from the dialysis solution. Over time, this extra sugar can lead to weight gain. So here is a picture depicting the peritoneal dialysis. Here the fresh solution is being passed into the patient, and after 60 to 90 minutes, when the equilibration of the solutes occur, we just simply return the fluid out into a drain bag. This tubing is called as disposable tube, and the Y-shaped connector is also known as transfer set. So this was a small short video about the types of dialysis. Hope you enjoyed. Do share it with your friends. Like, share, subscribe. Thank you.